Every essential amenity in today's society is being digitalized, so why not healthcare? Greetings to everybody. With our project or idea, the Health Guru, we, the Team 10 hacker cells of ASE, provided a resolution to this problem. Now looking further. Digital technologies have advanced more rapidly than innovation in our history, reaching around 50% of the developing world's population in only 2 decades and transforming societies. Digital technologies are now integral to daily life, and the world's population has never been more interconnected. Innovation, particularly in the digital sphere, is happening at unprecedented scale. Even so, its application to improve the health of populations remains largely untapped, and there is immense scope for use of digital health solutions. India's healthcare system is biased towards urban regions, which is 28% of the country's population living in urban areas and having access to 66% of the country's hospital beds, compared to the remaining 72% who dwell in rural areas who only have access to one-third of the beds. Patients in remote locations postpone treatment or make do with amenities that may be easier but are not cost effective or even suitable to their needs due to a lack of accessible healthcare services, difficulties in acquiring transportation, and loss of earnings.
Is a boy by the name of Ganesh. He was completely healthy and in good condition. One day, however, he became unwell due to the viral fever, and because the remote settings precluded access to the emergency care, it took some time for the nearby doctor to show up. He began to feel better after seeing the doctor and taking the medication the doctor prescribed. However, soon after, due to the poor diet, he became ill once more and his condition worsened. He then went to the hospital that had been recommended to him by someone, only to discover that they were all booked up. Then patient visitor who was aware of Ganesh village advisor to hospital that was close to both his home and the current hospital. He went to receive medical care. Then he went to the recommended hospital, received the necessary care and recovered. Now let's look at an example where our idea was put to use. When Ganesh became ill, he entered his symptoms into an online prescription recommendation system where he received prescriptions from the reputable medical support and a diet plan necessary for recovery. He recovered, but he was unable to return to his prior condition. So he used the hospital recommendation feature in our idea to find the information of the closest best hospital with opening, and then he went there immediately to receive treatment, and post treatment he returned to his prior condition. Now let's see the features of our app. The app consists of an AI based online medicine prescription system which recommends medicines based on their symptoms and their severity and delivering those medicines from nearest medical shop. Next, patient monitoring and food diet recommendation based on his health records. Furthermore, we are going to arrange an online doctor consultancy where we will speak with the doctor directly about one's illness and the best hospital suggest nearby you based on the recommendations, and also appointment and bed booking. And then we also included an instant loan system for the instant approval of amount for the needy. For the stat, now moving on to the statistical data of the digital health, we can see from 2016 to the present there was a growth in digital health usage as well as its economy. The global digital health market size was valued at 96.5 billion US dollars in 2020, and it's expected to grow at a compound annual growth rate of 15.1% from 2020 to 2028.
Revenue generation is one of the important aspects. In our app, we can generate revenue by advertisements, by an in-app purchase, that is medicine buying and delivering, and also from interest amount that we get from instant loans, and finally freemium, where user will be accessible to certain features by premium account. Developing a solution is not an end, but it should reach to people. So we can reach them out by setting up an informative blog, by email marketing plan, and should invest in and run creative online ads, building a social media presence, and investing in video marketing. We hope this presentation is informative and marks a new beginning for the digital health ecosystem, enabling more effective delivery of healthcare services. Thank you.